So Mrs. C is a 60-year-old female who presented to the hospital. Sepsis most likely causes pneumonia. She was found to have severe acidosis, pH is 7.2 and bicarb is 5. So when you do a B&P in these patients, the first thing we do in patients like this is, unless they're having respiratory distress, we just do a CBC and a B&P. So when you do a B&P, you're going to see that the patient's bicarb is 5. You're going to follow that with an ABG or VBG to see where the patient's pH is. And let's say it's 7.2 and bicarb is 5, and sometimes it's even lower than that. So other than fluids and antibiotics, how would you treat this acutely? So this patient has acute kidney injury or acute kidney failure from the sepsis, and her creatinine is up and her bicarb is low. So in these patients, you can actually start them on a bicarbonate drip, okay? And this happens a lot. I mean, we use bicarbonate drip a lot of times in the patients, especially in patients in the ICU with acute kidney injury. And again, this would be metabolic acidosis because the bicarb is low and the patient become acidic because they don't have the bicarb that is needed as a buffer.